Adjunct Professor Jane Halton is a former chair of the board of the World Health Organization, a former president of the World Health Assembly, and now chairs an international body called the Coalition for Epidemic Preparedness Innovation, long title, and sits on the board of Scott Morrison's COVID-19 Coordination Commission. She joins me now from Canberra. Jane, thanks for coming on the show. In addition to all of those roles, I want to remind my viewers you're also a former long-standing Secretary of the Federal Health Department and also a former Secretary of Finance. So you're well equipped to talk about the economic hit as well as the health aspects of this virus. I want to talk about vaccines. Some very encouraging reports today. Where are we on all of this?
Well, I think we should acknowledge there's a huge amount of work being done on vaccines, and we've seen some really positive early signs from a Moderna phase 1 trial in respect of whether a vaccine they're developing is safe. Now, we need to remind ourselves it was 8 or 9 or 10, very small number of human patients who were actually administered this vaccine. But it's good to see that we've now got a first result in an inhuman trial, which is looking positive. And I think we should all feel hopeful that this won't be the first and last, but there are several others to follow.
If we do get a vaccine, how easy would it be to manufacture here in Australia? I understand a DNA type vaccine. We don't yet have the technology to manufacture that, but we obviously lead the world in a lot of other types of vaccine manufacture. And where would we be in terms of the queue in accessing a vaccine?
So, of course, this is the $64 billion question right around the world. Every single person, all nearly 8 billion people in the world, my bet is will want a dose of that vaccine when it becomes available. And of course, we don't yet know how many or where they will be, successful vaccines there might be. And indeed, we just need to remind ourselves that there's still no vaccine for HIV. So much as I'm optimistic, we just need to remember that as yet we've never had a vaccine for a coronavirus, and in other areas we have yet to succeed. But if we do succeed, and hopefully with more than one candidate, then obviously scaled up manufacturing done around the world and done really, really rapidly is going to be hugely important. Australia is one of a small handful of countries that actually has onshore vaccine manufacturing, which is fantastic. 19 or 20 countries have that capacity. But as you say, we don't yet know the technology that would be used, and therefore whether we would be able to produce it here or we would be looking to supplies from elsewhere, we don't know yet.
We're still talking, I know in the reports today, of 12 to 18 months if every sort of duck lined up in a row. Before we talk vaccines, obviously, there's also treatments that you have once you contract coronavirus. We hear about hydroxychloroquine, that President Trump seems to be taking that. I know it's being used in some early trials on health workers. Is there anything else around?
Well, basically, in addition to working on vaccines, research scientists around the world are using every product that they can think of to run a battery of reviews and tests to see whether there's any prospect that one of those antivirals or indeed other medicines might be of use. Because as you say, and take HIV again, we have treatments now. It's a chronic disease. It's not an instant death sentence. So, and we would hope that we would get treatments probably more quickly than we would a vaccine. And if that's the case, then obviously we may be able to prevent the very many deaths that we continue to see around the world. But again, it's early days. And I do think it's actually quite brave of someone to take an as yet unproven medicine in respect of trying to ward off contracting the virus. I would advocate actually people take non-pharmaceutical interventions much more seriously before they go taking an as yet unproven medicine in this area.
I want to go back to your time when you were the Secretary of the Health Department in Canberra. You really kicked off with Tony Abbott, I think he was the Health Minister at the time, all of the national plans for pandemic preparedness, whole lot of testing and tracing regimes, a lot of the stuff that we're seeing now. Now, one of the real wins we have here is we're an island continent. We shut our borders relatively quickly. Now, if we want to get the economy up and running in the absence of a vaccine, how important do you think it is that our borders stay shut to anyone other than Australians coming home?
Well, we're going to have to balance up the risk and the reward here. And certainly at the moment, if you think about it, our borders aren't completely shut. There are Australians who want and need to come home. And they are coming home and they're being put in quarantine, which is being organised and managed by the states and territories quite effectively, I think, to put those people in quarantine for 2 weeks. So when they re-enter the community, we know that they don't carry with them a virus that they can then infect others with. And you may well have seen in New South Wales, I think the 4 cases that they identified in the last 24 hours, they were all in travellers who had returned and who were in quarantine. So no community transmission. But we can't shut ourselves off in perpetuity, and we have to find ways to manage trade, some limited travel until that becomes safer to do so, because at the end of the day, our economy will suffer. And let's be clear, that means people who work in our economy, young people, people who are trying to make their way in the world, they will suffer too. So we've got to find a new way to work while we're waiting.
I want to ask you about transport. We know in New South Wales there's going to be quite significant social distancing on public transport, but no masks. Qantas, on the other hand, is saying that it won't be social distancing on flights. There was talk that the middle seat on an aircraft will be blocked out. That's not going to be the case, we're told, but instead that people will get masks. Now, every day someone's saying wear a mask and someone else is saying on the same day don't wear a mask. Where are we at with some action that ordinary people can take as they start to get out in the world in the next few weeks?
Well, I mean, certainly I'm not aware of the advice that Qantas has received, but what I will say is that Qantas, unlike, for example, public transport, if there needs to be a trace of somebody who it does turn out to be positive, they know every single person who has been on a plane and they know exactly which seat they were in. So that's certainly, if you think about even the app, the whole objective of that is that we find people who've become infected and we find them really quickly. They're providing masks, I understand, as an option, which I think is excellent. And I'm sure you, like me, have already seen people in our communities who are walking around, and because they feel vulnerable, they're wearing masks. So it's an active choice that people can take. And certainly in terms of public transport, there are going to be many adjustments made here. I think not the least of which I've seen many more people cycling to work, and active transport, I think, is something people will choose to take. But we're learning how to do this new work. We're learning what's going to enable us to work and stay safe. And we're going to make a few mistakes. But let's hope that when we do make those few mistakes, we can rectify them really quickly by finding people, giving them treatments, and also stopping the spread of the virus.
Jane, I don't think there's an Australian who would have more understanding of the World Health Organisation and the member states, the Assembly, the whole box and dice as you do. Are you confident after the decision overnight that we will have a genuinely independent inquiry into the origins of this virus?
So, firstly, I think, and you're right, I've spent a very, very large number of hours engaged in WHO business. I've done all sorts of roles there. All of them are privileged, but quite difficult. And the resolution that was passed by consensus, and I think it's important people understand that China and everyone else let that resolution go through without forcing it to a vote, that's really significant. It's 7 pages long, Peter. And so what it does is go through all sorts of issues, including access to medicines and vaccines. But it does 2 things which I think are relevant to your question in particular. One of which is it asks the Director General, working with the FAO and the organisation responsible for animal health, to actually continue to look at the zoonotic origins of this illness so that we can learn, so we can have better animal husbandry, better science, and therefore try and prevent this sort of thing happening again. So that's one component of the resolution. And the other part of the resolution is this evaluation of the response. And that includes use of the independent bodies that are part of the WHO to be party to that. I think these are both really important steps. Now, as I think I just heard the Foreign Minister say, that we don't want to necessarily burden people right this minute. We're in the middle of a crisis. So I'm not concerned that some of these actions will not occur for a little while. We need to focus on what's most important now, which is saving lives and putting in place measures to prevent spread. But then we do need to have a look at how we've managed, what we can improve, and if necessary, make changes. And let's think about this. As the Australian population, we will expect that we will have a good look at how we've managed, and we've managed really well, but I'm sure we can learn from our experience. Every other country will do the same, and it's quite right that we do that in the context of our international organisation. So I think it's a good development.
We will come back, we'll circle back in a few months' time, Jane Holton, and see how we're going. Professor Jane Holton, thank you very much for your time.
It was my pleasure.